A very good morning to one and all. I'm so happy to see you here in this COVID period, and I would like to thank wholeheartedly the government of Tamil Nadu for giving me this opportunity. And in addition to that, I would like to thank our institution, our administration, the PSG IMSR for taking this great effort to lend us to teach you in this enhance with our PSG department. I am Dr. Punitha from the Department of Community Medicine. I am an assistant professor working here, and hope you will be enjoying this session with us. To start with, we would be discussing about the non-communicable disease, that is the lifestyle disorder. As of now, you might have heard from Dr. Janeth regarding the communicable disease. Okay, so in this session, we will be seeing about the non-communicable disease, what are the risk factors and how would you prevent it. Before going into the proper non-communicable disease, let us see the introduction, that is how it is differing from the communicable disease. You all know, right? You might have heard from Dr. Janeth, right? What is a communicable disease? How it is being transmitted? What are all the causative factors? Can you just recollect? I think you are recollecting. Yes. If we just see that the causative organism for communicable disease is what? Viruses, bacteria, protozoa, many things are there. Whereas for non-communicable disease, it is only multifactorial. It is not only the single causative organism, it is physiological, environmental factors, genetic factors, many factors, physiological factors, many factors are there. Hence, it is called as multifactorial. And the onset of the disease is acute in communicable disease, whereas in non-communicable disease, it is chronic. Similarly, the progression. It is slow in progression in non-communicable disease. In communicable disease, the progression is so fast. Some exceptions are there like AIDS, whereby soon after you get the virus infection, there will be some latent period or the window period where you will not be seeing any symptoms. However, it is not like that in other diseases. Some exceptions will be there, right? Then about the treatment. There are specific treatment for both communicable disease as well as for the non-communicable disease. That is seasonal variation that will be present in communicable disease, whereas in non-communicable disease, you will not have any seasonal variation at all. And you will be having the hereditary disorder. Let's say it is inherited from mother to parent. For example, if a mother is diabetic, there is lot many chance for the child to get diabetes. Okay, so it is inherited. Clear? So these are some of the differences between the communicable disease and the non-communicable disease. Let us see how big is a problem. Let's say if you take the country India, okay, as per the World Health Organization report, okay, 2018 for the year 2016, it is said that, let's say if you take 100 people who are dying, okay, the proportional mortality rate, okay, if you just take it, the contribution from the non-communicable disease is nearly 62%. Okay, if 100 people are dying, 62 people are because of this non-communicable disease. If you just take it, majority is contributed by the cardiovascular diseases, and then the chronic lung diseases, injuries are there, and diabetes is there, hypertension is also there. So I would just want you to know that how big is the problem. Clear? Yes. Next we shall see, though if you just take the deaths that is occurring in non-communicable disease, majority of them are in the age group of 30 to 70 years. Imagine how big is a problem in the economically productive age group. Okay, younger population are dying. Okay, early age. And then there is also nutrition transition because of the globalization of the nutrition. Okay, and there is lot many people nowadays, you will be very fond of junk food, right? Okay, high density food, high energy density food, right, rather than the food that is rich in nutrients and fiber. Yes or no? You like chocolates, pastries much? Yes or no? Okay, rather than eating the green leafy vegetables and fruits and vegetables. Yes or no? Yes. So there is transition, nutrition transition, an early age onset, and more than that, the non-communicable disease, or otherwise called as the behavioral disorders. Okay, lifestyle disorders. Why so? Because the behaviors matters much, because the smoking, alcohol intake, your lifestyle behavior determines this disease. Henceforth, it is called as the lifestyle disorder. Clear? Very important thing that you should remember in non-communicable diseases, there is double burden of disease. You may think that only communicable diseases are higher. The non-communicable disease is not much higher. But nowadays, it is an emerging epidemic. Henceforth, both the communicable as well as non-communicable disease are impinging burden in the population. Okay, and previously there is thought that only the higher socioeconomic status people are getting this non-communicable disease like diabetes and hypertension. But of late there is reversal of social gradient. It's nothing but both the high socioeconomic strata as well as the low socioeconomic status are getting. Nowadays the rural population as well as the low socioeconomic strata people are getting this non-communicable disease. So remember this. Okay. I had been telling you about this non-communicable disease, lifestyle disorders. Can you remember what are all the things? Can you just name something? Are you naming it? Yeah. Yes. Diabetes, hypertension, chronic lung diseases, yes, cardiovascular diseases, okay, which includes heart attack and stroke, yes, and cancers. And other non-communicable diseases are the mental illness, okay, road traffic accidents and many things are there. But most important thing you should remember is diabetes, hypertension, chronic lung diseases, cardiovascular diseases and cancer. And very important is the mental illness. Clear? Yes. So, as of now you have learnt about what is a non-communicable disease, how it is differing from the communicable diseases, what are all the various types of the non-communicable diseases and how big is the problem. Okay. Now, we shall see what are all the risk factors of the non-communicable diseases. Why we should know this risk factor? Why? Because if you want to do any prevention, you should know what are all the risk factors. Unless you know the risk factors, it will be very difficult for you to prevent. Clear? Can you name some risk factors? Whatever you know. Can you name? Yes? Yeah, I had been telling some risk factors, right? Smoking, very good. Alcoholism, okay, the food items that you like much, the junk food, right? Yeah, junk food items, okay, and sedentary life behavior. All this in this lockdown period, what you are doing? You are sitting at home, watching TV or the online classes. You are so sedentary, right? Because the government prevent us to go out, right? To carry out our physical activity during this lockdown period, I am telling. But nowadays, there is lot many opening has been made and you are allowed to go out and follow your daily activities, okay, and the junk food taking and obesity, okay, and then stress, another important risk factor, and salt intake. How many of you like puppets, chips? Yes, most of you, right? Yeah, even I like chips. However, okay, you have to decrease the intake of salt. I could see that majority of the school children like the salted items, especially the chips, okay, fried items, okay. So that is one of the risk factor, okay. Just assess yourself, how much are you, okay, at risk, yes. And then other one is the destructive weapons, usage of the destructive weapons, and then the construction works, and then pollution of the air and water. These are all some of the various risk factors that makes the people to go into this non-communicable diseases, okay. So if you just take all these risk factors, it could be classified into modifiable and non-modifiable. What is modifiable? You can change it, you can alter it, you can prevent it so that you will not get this non-communicable diseases. Okay, what are all the modifiable? So previous slide, or I was telling you about the various risk factors. Can you just name some modifiable risk factors? Yes, those things which you have control on it. Smoking, alcoholism, okay, the binge eating, obesity, hypercholesterolism, hypertension, okay, all these things are modifiable. There are some non-modifiable risk factors where you will not have any role at all. Let's say your mother is diabetic, there is chance for you to get diabetes, that you cannot modify it, right? Yeah, so genetic issues, age, gender and all those things is non-modifiable. So henceforth you can divide the risk factors into modifiable and non-modifiable risk factors. Clear? Yes. If we just see various risk factors, you might have heard of modifiable risk factors, non-modifiable, so many risk factors, right? Okay. These many risk factors, if you just see, are the causative reason for this various non-communicable diseases. Clear? If you just avoid these risk factors, you would be preventing this non-communicable disease. So now would you be able to recollect what is the importance of knowing this risk factors, right? Yes. Now let us see how to prevent this. Okay. So prevention is better than cure. You might have heard of this, right, in your school days. Yes. So there is various levels of prevention: primary, secondary and tertiary level. Okay. Primary prevention is nothing but before the occurrence of the disease. That is primary level of prevention. Secondary level of prevention is the disease might have occurred or on the verge of occurring and you would be early diagnosing the disease and you will be treating the disease. That is secondary. Tertiary is nothing but the disease might have occurred, yes, and complication might have occurred. Henceforth, you will be preventing the disability and you will be rehabilitating. Clear? We will be seeing this in detail. Okay. And above all, at the school age, the type of prevention that is very, very important for you is the primordial prevention. Primary prevention is before the occurrence of the disease. Primordial prevention is before the emergence of the risk factors. At the school age group, you might not be exposed to much risk factors, right? Smoking, alcoholism, obesity. Obesity might not have been, come to you, right? The smoking or alcoholism or whatever it may be. However, the prevention of occurrence of the risk factors is the primordial prevention. Clear? So, you have this in your mind that primordial prevention is very much important at this school age group. Clear? Yes. So, I had been telling you about the various levels of prevention, right? What are all the various levels of prevention? Yeah, primary, secondary, tertiary and above all is the primordial prevention. Okay, at this age group, in your school age group, this primordial prevention plays a major role because you might not have been exposed to the various risk factors I had been talking about. Clear? Yes. So, primary level of prevention. Primary level of prevention is nothing but you will be having so many risk factors, however, the disease would not have emerged. How to do this? Can you name some? How to do this primary prevention? Yes, eating healthy diet. Okay, eating lot of green leafy vegetables, fruits. Yes, yes. And then what? Going for a walking. World Health Organization has suggested that per day 30 minutes of brisk walking is must. Okay, 30 minutes of brisk walking is must. Okay, that is the physical activity that is recommended by the World Health Organization. Clear? And other one is I have told you about the diet. In diet I had told you about taking off lot many green leafy vegetables and fruits. In addition to that, salt restriction. I will be telling you about that salt restriction, how to do the restriction. Okay, and other one is in order to have a safe, sound mental health, you need to have what? Meditation and prayer. It plays a major role in calming down your mood. Clear? And other one is, the major one is the behavioral aspects, stopping or avoiding alcohol and smoking. I was telling you about salt intake, right? The World Health Organization have suggested that ideally 5 grams of salt per day per person. That is the recommended amount. How to assess this? Okay, you school children, okay, anyhow you will not be cooking, right? Only your parents, your mother will be cooking. But how you will assess? I will tell you a way. Clear? Okay, you just ask your mom. Okay, mommy, let's say 4 people are there in your family, right? Okay, so 5 grams per person per day. So for person, how much gram will be there per a month? 5 into, let's say 4 people are there, 5 into 4 and then for a month 30 days. How much? On an average it will be around 600 grams. Clear? Okay, so 1 kg minus 600 grams should be your consumption. 1 kg minus 400 grams. Okay, I have told you the reverse way. Okay, so your requirement is only 600 gram per month. Clear? Okay, so you can just assess. Okay, let's say for a month your mummy has got or has used more than 1 kg of salt. You would tell your parents that we are consuming huge amount of salt. Okay, there is a chance for your parents to get hypertension or no others. Okay, and other one is nothing but World Health Organization has suggested that rotation of oil. What type of oil is being used in your houses? Sunflower, groundnut oil, gingerly oil. Yeah, so many oils are being used, right? Some people may be using coconut oil, right? Yeah. So it is suggested that you should use the oil in rotation. Let's say this month you have used sunflower oil, next month you use groundnut oil. and the other month gingerly oil. So that is how we should rotate. What is the need for this rotation? Because there will be some amount of polyunsaturated fats, the fatty acids that will be there in one oil that may not be there in other oil. So that is why there will be balance in the saturated and unsaturated fatty acids in the correct amount. Henceforth, there is needed for this rotation. Clear? And then avoidance of your favorite item. What is that? Deep fries. You like deep fries, right? Yeah, French fries, KFC. Yes, so you should avoid all those things. Because I have tell you about this primordial prevention. Primordial is nothing but you should prevent the occurrence of the risk factors. At this age group, if you follow all these things, you would prevent the occurrence of risk factors in your life, whereby the primordial prevention would be carried out and there would not be any need for this primary, secondary and tertiary level of prevention. Okay? Yes. So as of now, we have seen about the various levels of prevention, whereby primordial we have seen and then primary level of prevention. The next one is the secondary level of prevention. I forgot to tell you about one thing. It is about the DASH diet. Okay? So especially how to prevent this hypertension. Okay? How to prevent this? That is by taking this DASH diet. You would be taking more of the cereals and then vegetables, fruits, yes, and you would be decreasing the amount of fat. Clear? And then you will be taking only the lean meat, okay, the meat that is rich in protein and low in fat. So this type of diet is called as the DASH diet. Clear? These are all one of the method of preventing this hypertension. What is the secondary level of prevention? Okay, so primordial is nothing but before the occurrence of risk factors. Primary is the risk factors are there, the disease has not occurred. Okay, so prevention of the disease. And secondary is nothing but it is in the verge of getting the disease. So early diagnosis and treatment. How would you do this early diagnosis? How would you diagnose at an earlier age? Have you heard of screening? Yes. So you have to screen. That is why we take all the effort to screen the public. Okay, if the age is more than 30 years, we screen them for diabetes, hypertension by checking the blood sugar and BP. And not only that, how would you screen for cancer? There are various screening methods for screening the cancer. Let's say for a woman, most commonest cancer is cervical cancer. How to screen it? We tell it is a pap smear. Okay, if the age is more than 30 years, okay, and sexually active women, they have to go for this pap smear every year. Clear? Okay, and then other one is the breast cancer, which is commonest in women. So you have to go for this breast self-examination. Okay, in this age, at least you should know that how there are various screening methods that are available even to prevent cancer. And some of the investigations like mammography. Clear? Okay, so early diagnosis and then treatment. If you just take the treatment, it is very, 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 very important in non-communicable disease. Clear? If you just take communicable disease, if you just get any cough or cold, if you just take one antibiotic, you could be able to take maximum for 7 days. That's all. Your infection would be cured. You may not continue the treatment for lifelong. Okay, there are some diseases like AIDS where you have to continue the treatment. Okay, so I'm not telling that, I'm just telling about the commonest diseases. Whereas in non-communicable disease, you have to take the treatment for lifelong. If somebody is diabetic or hypertensive, okay, or cardiovascular disease is there, they have to take the treatment for lifelong. And the cost of the treatment is also high. Okay, for let's say cancer and all those things we just take, the cost of treatment is high. Clear? Okay, yes. So regular treatment is very, very important to tackle this non-communicable disease in the secondary level of prevention. Right? Yes. The last level of prevention is the tertiary level of prevention. It is nothing but disability limitation and rehabilitation. Clear? Once a person has got diabetes, okay, and complication has occurred, one of the complications is diabetic foot. Okay, you might not know that. Okay, I'm just telling about one complication, diabetic foot, whereby they'll get one wound in their foot, okay, a non-healing ulcer, which would result in amputation of their leg, to take off their leg. Okay, after that, the thing is the tertiary level of prevention. You can prevent it, or you can give some artificial limbs for them, you can give physiotherapy. There are various levels of rehabilitation that is there, physical rehabilitation, mental rehabilitation, vocational, educational, okay, many types of rehabilitation are there. It depends upon the type of illness the person are getting. Clear? Okay. So as of now in this session, okay, briefly we might have seen about what is the differences between the non-communicable disease and the communicable disease, and what are all the risk factors for the communicable disease and non-communicable disease. Especially in this session we are focusing on the risk factors of the non-communicable disease. Clear? And how to prevent it. Various levels of prevention, the primary, secondary and tertiary. Okay, the various levels of prevention. And very important thing that you should remember is mental health. This is also a non-communicable disease, and you know that the communicable disease or the non-communicable disease, both things will lead to mental illness. Okay, that is the physical health, whether it is communicable or non-communicable, they will lead to mental illness, psychological problem. If you just take a person who is affected with cancer, or nowadays a person who is affected with COVID-19, whether it is communicable or non-communicable, there is not many chance for them to get psychologically impacted. Clear? So it is a vicious cycle, the physical health and the mental health. Okay, if there is illness physically, there will be illness mentally. It is a vicious cycle, irrespective of communicability, whether it is communicable or non-communicable, it leads to mental illness. Clear? Okay, so a very important thing that you should remember is, it is the perception. What you perceive will result in the psychological aspect. If you perceive it as a good thing, if you perceive it as a confident thing, okay, if you perceive it as that, yes, I will be able to say no for smoking, say no for alcoholism, yes, I will be able to make out all the lifestyle modifications. If you perceive that it will be possible for you, definitely you will be able to tackle it. Very important thing is, if you just build a hope in an individual, okay, by improving their perception, you would be able to build hope in their family, and you will be able to build hope in the society and in our whole country. Hope this session would benefit you to know about a few things about non-communicable diseases, what are all the various non-communicable diseases, what are all the risk factors, and how to prevent this. Jai Hind. Thank you.